More than 26 million Americans have now filed for unemployment, the highest number since the Great Depression. Hello, I'm Anand Naidu, and this is The Heat. The coronavirus continues its deadly assault around the world, taking an unimaginable toll on human life and bringing the world's economy to its knees. Here in the United States, the coronavirus has put another 4 million people out of work as states struggle to balance the health of their residents with reopening the country's economy. The European Union, meanwhile, failed to agree on a multi-billion-dollar euro recovery fund. Major developments around the world, but first let's go to Giles Gibson with us live here in Washington. And Giles, President Trump at his usual press briefing, his daily news conference. So what are the headlines out of today's news conference?
Well, that daily briefing is still going on, Anand, but President Trump started this briefing applauding this new emergency relief bill that's been passed in the House of Representatives just in the last hour or so. It's a $484 billion bill, and what it does is boost funding for this small business loan program that's been completely maxed out in the last week or so, and it's also providing extra cash for testing and for hospitals. Interestingly, we also got an update from a Trump administration official about a study that they're conducting into how the virus reacts to different atmospheric conditions. This official saying that in higher temperature, higher humidity, and also direct sunlight, the virus actually dies much faster.
And the other news today, Giles, those were the jobless figures that came out. As I just said, 4 million more people now jobless, taking it to over 26 million across the country. What are the sectors that have been hardest hit in this country?
Yeah, the numbers of unemployed really keep stacking up week by week here in the United States. To give you the exact figure for last week, 4.4 million people filed for unemployment benefits here in the United States, and that brings the total figure for the last 5 weeks to just an astonishing 26.4 million people. Now, we also, in terms of the sectors that you asked about, we also got some new data out showing that output in the manufacturing and the services sectors has plunged to historic levels. So those two sectors could be where we're seeing a lot of these job losses.
Thanks, Giles. That's CGTN's Giles Gibson reporting there. Well, lots to discuss. I want to bring in our panel. Victor Gao is a CGTN current affairs commentator. He joins us from Beijing via Skype. From Brussels, I'm joined by Pieter Cleppe, a political analyst on European Union affairs. And Dan Raviv joins me here in Washington. He's an author and columnist for New York's Newsday. Welcome to the show. And Dan, let me start with you. We've just been talking about those jobless numbers, 4 million more people filing for jobless claims. And I guess it's a huge balancing act for the country's governors. How do they get the economies restarted in a safe way? I mean, if we look at the state of Georgia, it's one of those states where we've seen a number of people file for jobless claims. But it's, we're going to see some of the businesses, some of the business sectors opening on Friday, others on Monday. How much pressure do you think governors are under right now when we see these kind of jobless numbers?
Anand, it's great that you mentioned Georgia, because that's the state right now that seems to be the test case. The Republican governor there, his name is Kemp, is in fact defying President Trump. Kind of a surprise. Trump had been very pro-Kemp in the past. Now there's some bitterness because the governor wants to reopen even nail salons and hair salons. President Trump says that doesn't sound safe to him. Why doesn't the governor wait for a while? Apparently there's a lot of pressure in Georgia, also in other states, and typically in what we call red states, where Republicans are dominant, where people want to get back to work. They don't want to be ordered by the government or by health officials to stay indoors. Everybody wants to have their freedom to choose. The trouble is, in Georgia, it seems that COVID-19 is still on the rise. There could be a greater death toll, and maybe in part because of the easing of restrictions. Everyone seems to be watching Georgia to see whether Governor Kemp is getting it right or wrong, Anand.
Of course, Dan, governors have to factor in safety issues, and there have been guidelines which have been issued by the White House. Those guidelines have to be implemented in phases, phase 1, phase 2, phase 3. Are they not working?
Well, it's worth knowing that those, in fact, are recommendations. And it's true, the Trump administration leaning mostly on the health experts, the scientists in the administration, came up with a list of what needs to be done in phase 1 and then only then move on to phase 2 when there is, for instance, a decline in the rate of hospitalizations and deaths from COVID-19. So Georgia is defying that. But it's up to each state. The president decided to say that he trusts the governors to make the right decision. You can imagine some skeptics about President Trump say that he's trying to shift the blame, that if there is some disaster or a greater death toll in any state, then the president won't be blamed. He would say he's left it up to the governors.
All right, let's move to Europe, to Brussels. Pieter Cleppe, EU finance ministers have been meeting to figure out a way on rescuing their economies. We shouldn't forget that Europe has also been ravaged by the coronavirus. So that meeting taking place via video, did they come up with anything? Did they have any success?
Well, there has not been a deal, and it's looking likely that a deal may only be there at the end of this year, at the earliest. The reason is, let's say, a lot of opposition in the north of Europe against more spending programs that would supposedly be this time designed to deal with the COVID crisis and more in particular the economic fallout. Now, what we see is that Northern Europe so far has managed to oppose calls from the likes of Italy, Spain, and also France for more spending, and everything is basically being kicked into negotiations that were already ongoing, negotiations on the long-term budget of the EU. So every 7 years there are negotiations on the 7-year budget of the European Union. So they basically, the plan now is to combine both things together.
That's right. The Commission President Ursula von der Leyen said that the next 7-year budget would have to adapt to new circumstances. But Peter, can the bloc, the 27-nation bloc, afford to only do this at the end of the year?
Well, that's the question, of course. I mean, I think we have to really be careful to simply throw money at all of this. I mean, the first corruption and fraud cases are actually already out. Notably in Berlin, the German government is throwing a lot of cash around, and already now we see mismanagement and fraud apparent with that. So I think it would be wiser to wait and see where the actual economic needs will arise. I mean, obviously everybody will be hit, but not everybody will be hit in the same way. And I think the important thing is, first of all, to make sure that any support is not permanent, that it's very targeted, and that we don't create new entitlement programs that will basically undermine competitiveness. Of course, second, I think at the end of the day in Europe, I mean, we're talking about such huge sums of money that the European Union policy level does not have the legitimacy to spend this. Democracy is still a national thing in Europe. So if a lot of money is spent, I think national democracies have to have the last word on it.
Peter, very quickly, you were talking about the opposition coming from northern European states. Is there a very deep division between the north and the south? And we know that there are countries in the south along the Mediterranean, Spain and Italy being two of them, that actually were hardest hit by this coronavirus.
Well, yeah, there's a big divide. Now, there is no opposition, I would argue, in Northern Europe against helping the South to deal with this crisis, but there's opposition against paying for debt that predates the COVID crisis. And of course, it's not always easy to determine which damage is from the crisis.
All right, let's bring in Victor Gao in Beijing. And Victor, China has not reported any new coronavirus-related deaths, or coronavirus-related deaths, I should say, for the 8th straight day. What is the situation in China right now? And do you sense that life is returning to some kind of normality?
Yes, indeed. I think China has really made a very important turn in the fight against coronavirus. Economy is gradually, let me emphasize, gradually being normalized, but no people are really complacent. I think everyone is still on alert. People keep wearing masks sometimes, mandatorily. And the top challenge right now is to guard against imported infections. We know the United States only has Canada and Mexico as its land neighboring country. China altogether has 14 neighboring land countries. So the challenge is very, very harsh. And now we have a very serious situation up north in the province of Heilongjiang, bordering with Russia, and lots of imported cases of infection from Russia. So this is really creating a lot of crisis in the northeastern part of China. And also because people move, if you do not really check them out, and this will pose a threat to all the other parts of China. So I think China's strategy is to tighten its border control very much, test everyone coming in, and quarantine people to make sure that the newly imported coronavirus does not get spread around like a wildfire.
So what are the precautions that China is taking, Victor? Are people, is there some kind of lockdown there to prevent people from traveling from that part of northeastern China to other parts of China?
Yes, of course. In select cities in the Heilongjiang province, the lockdown is there, being imposed. And also, one thing which differentiates China from the United States is that here in China, everyone wears a mask, whether you go out for a stroll in the park, whether you go to work, whether you go to a shop. And a body temperature is mandatorily taken whenever you go into a public place like a mall or any other transportation facilities. And I think this really helps the authorities to put a lid on any possible flaring up of the coronavirus, especially because we know throughout the world that it takes about up to 14 days for the incubation time for the virus. And also, more and more, we realize that there are people who are asymptomatic. They do not have any symptoms of getting infected, but actually they still already carry the virus. So I think vigilance is absolutely necessary.
Dan, Raviv, we look at the response to the coronavirus epidemic here in the United States. It has become very, very politicized, with opinions broadly falling along partisan lines. And we do know that the United States is in an election year. But is this election in November really going to be a referendum on how this administration handles this coronavirus?
It simply has to be. This is the biggest crisis that any American president has faced, certainly since the Second World War. And so will there be any other question? In effect, voters will have to decide whether Donald Trump has handled the coronavirus crisis well. That decision is just over 6 months away. November 3rd is Election Day. Even President Trump at his daily briefing just a short while ago was asked at the White House about the election, what the impact could be on the election. I think the reporter was wondering whether voters will feel that they can safely go out and vote. The president actually answered it a different way. He said that his opponent, Joe Biden, who apparently will be the nominee of the Democratic Party, has been holed up at home in his basement, hasn't been able to go out, hasn't been anywhere. And President Trump claimed the Democratic Party has been keeping Biden there, whereas Trump is trying to show that he is extremely active every day, speaking at a briefing and boasting that America has great testing. He also said, by the way, and this ties in with what Victor's reporting from Beijing, that if in the United States COVID-19 comes back in the fall or the winter, President Trump says we'll be in great shape to know about it and quash that right away, because we'll have more testing, the ability to trace whoever got it and where they got it from. And Vice President Pence, in charge of the coronavirus task force, he also said we'll be in good shape to do that later this year. Apparently they expect COVID-19 to come back, but they're trying to say it's probably not going to be a big crisis here.
Peter, very quickly, we've only got about a minute left. There's some news that has come out from the World Health Organization that tells us that up to half of the coronavirus deaths in Europe took place in long-term care homes. This was at a time when the authorities, healthcare officials, were looking very closely at hospitals. So did they, in fact, look in the wrong place at the beginning?
Yeah, absolutely. I mean, big mistakes have been made policy-wise, in particular because of the lack of equipment that staff in care homes basically was suffering from in countries like Belgium, in countries like Sweden. Indeed, this is something that probably has caused more deaths than would have been necessary.
Okay, and that's where we have to leave it. Pieter Cleppe, Dan Raviv, and Victor Gar, thanks to all of you for being with us. Fear of COVID-19 is also fueling anti-Asian sentiment across the globe, with many in Asian communities reporting incidents of verbal and physical assault. Earlier, I spoke with Rosalind Chou, Associate Professor of Sociology at Georgia State University. I asked her about her experience.
Well, as a race scholar and my focus being on Asian Americans, we know that the fear of this virus and its origins and blame being placed on China, we do see an uptick on Asians and Asian Americans here in the United States. So that's coming from places of xenophobia, issues with systemic racism, and just targeting people that we feel are different and foreign. Personally, I've also experienced this. I was on a flight to Los Angeles, and on the plane, there was a woman across in the row before me, and in the aisle right next to me, there was an Asian American gentleman. I found out he was Korean American, and another Asian American woman sitting next to him. And what she did, it was an older white woman, took a selfie or staged a selfie of herself and took the picture, sent it to someone with a message. And because the font was so big, I happened to see what it said. And in reply to her sending the picture, the response was, "Oh no, is he Chinese?" And she responded back to him, "There's a lot of them. Pray for me." So obviously, knowing that three of us were in the aisle behind her, the assumption was that there was fear invoked from our presence being on the plane with her to Los Angeles. And so that's one incident. I ended up confronting her, tapping her on the shoulder and letting her know that I could see what she wrote and that was inappropriate. That was pretty unkind. And to take that gentleman's picture without his permission was really inappropriate.
And what was her response?
She was pretty embarrassed. She stammered a little bit, was I think a little shocked that she was caught in the moment of what she had thought was a personal, private exchange. And she apologized profusely, said she was embarrassed, and that she was very sorry.
We're also seeing this from the highest levels of the United States government. President Trump has repeatedly called this the China virus. He says that all the time, and he also questions the origin of the virus. He was asked about it at one of his daily news briefings. Let's listen to what he had to say.
Why do you keep calling this the Chinese virus? There are reports of dozens of incidents of bias against Chinese Americans in this country. Your own aide, Secretary Azar, says he does not use this term. He says ethnicity does not cause the virus. Why do you keep using this? A lot of people say it's racist.
It's not racist at all. No, not at all. It comes from China. That's why. Comes from China. I want to be accurate.
About Chinese
yeah, please, John. Please.
The aides behind you. Are you comfortable with this term?
I have great love for all of the people from our country.
So, Rosalind, there you had a reporter asking the president straight out there, why do you call this Chinese virus? You heard his response there. I mean, is the president's rhetoric deliberately whipping up anti-Chinese sentiment?
Trump has made this part of his platform as when he was a candidate Trump. And now as president, I mean, he rallies his base around this type of rhetoric, fearing foreigners, fearing people, fearing China. And so this is right on par with that. This is no different than what he's done to invoke fear of China as the enemy. And, the unfortunate bit is that he doesn't rely on facts or history. H1N1 started in the United States. The Spanish flu actually has origins in the United States. And so he very much is aware of his techniques to rally fear, invoke xenophobia for fear of people from China.
Right, and it's not just President Trump, it's Democrats as well. The presumptive Democrat presidential nominee, Joe Biden, he's been running advertisements that are anti-Chinese. The Washington Post, which is seen as a liberal newspaper, has been publishing anti-Chinese conspiracy theories. I mean, have you ever seen anything like this before?
Well, we've had a history of yellow peril since colonialism, so this is really on par with the historical record we have of fear of the East in the West. And unfortunately, real people's lives are at risk for physical and verbal assault because of this political mechanism to place blame and fear on China.
As you pointed out, you're a race scholar. You've written 3 books on race topics. What is your view on why the United States responds to tragedies of this kind by invoking race? We saw that after the 9/11 attacks as well. There was this Muslim Islamophobia that we saw among many people. I mean, is this the way the country just responds to these things?
So it is based on difference, right? Then we have white powerful elites in the United States through colonial projects. And so it doesn't happen equally. These reactions, say the Oklahoma City bombing, for example, Timothy McVeigh of Scotch-Irish descent. We didn't see a mass racial profiling of people of Scotch-Irish descent on being terrorists. And so we see that in the United States, we have a long history of exclusion and fear of people of color. So we've seen this over and over again with different iterations of people seen as foreign, people seen as other. And so, this is the same racist trope that we've had throughout our history. And so yellow peril definitely being invoked here. And we saw that after 9/11. In my first book, there was a respondent that I had who he has origins, his parents are from India. But because he looks Arab American or could be assumed to be Muslim, he was driving down a highway in Texas and was driven off the road by 2 cars that surrounded him, perfect strangers in these trucks, but signaling, seeing this different foreign body and almost seriously hurting him, driving him off the road. So, this is a fear of foreign people, and what we see that there are powerful elites here, and through colonialism, those power structures being kept in place through white supremacy and racism.
We also see these anti-Chinese statements being made by local government officials. There was an exchange recently between a television anchor, Anderson Cooper, and the mayor of Las Vegas. Let's listen to it.
How this virus spreads. And I just want to put up for our viewers. I just want to put up for our viewers. This is a restaurant.
Anderson, you are tough.
No, I'm not
We're
talking.
back to China. This isn't China.
Yeah,
this is Las Vegas, Nevada.
Wow. Okay, that's really ignorant.
There she says, this is Las Vegas. This is not China. When you hear something like that, what does it tell you?
There's an assumption that these are uncivilized, dirty, disease-filled people, right? And that Las Vegas wouldn't have the transmission issues that somewhere in China would have. I mean, there are these just stereotypes of these uncivilized, foreign, othered people. That's what that sound clip really invokes.
What do you think can be done in terms of public policy to combat this kind of xenophobia and, in this instance, anti-Chinese rhetoric and statements that we hear almost daily?
Well, certainly leaders could step up and make statements that this is unacceptable, this type of xenophobia, this type of targeting, racial targeting. But beyond policy, so leaders, strong leaders stepping up and saying this is ridiculous, this is racist or xenophobic behavior, putting policies in place, that's not enough. It's about then enforcing policy. And unfortunately in this country, we've seen policy unequally enforced based on race at times, based on citizenship or assumed lack of having citizenship or rights as an American. And so really at this point, we need people to recognize humanity of other people, and really take to heart that we need to solve this public health issue and not really focus on who may or may not be to blame. I mean, the virus doesn't discriminate based on race. It doesn't know national borders. What we really need is to focus on managing what we need to get the United States in the safest place possible to then reopen our economy, or to make sure that our citizens are taken care of, all of them, whether they have appropriate documentation or not. That human lives are the price here, and that we need to help and save as many lives as possible.
You know, it's just not rhetoric or like the incident that you described on the airplane. There are many incidents where Chinese people have been physically attacked. In fact, the Asian Pacific Policy Planning Council reports that there have been more attacks against Asian women and children than there have been against men. And looking at all those things, do you fear for your own safety and your family's safety?
Absolutely. So, you know, I've been a race scholar for quite some time, and it's always been in the back of my mind. And since this outbreak has occurred, it has moved from the back of my mind to the forefront of my mind. I did, over a month ago, drive to Florida. My family is from Florida, and I was terrified driving down to stop for gas to get out of my car for fear of being harassed, being scared that someone could attack me verbally or physically. I have some elderly parents, and I worry about, they're in a very small southern town, and I worry about them going to the grocery store or being able to leave their house, and whether someone might verbally assault them or physically assault them. And, you know, as a race scholar, these are things that we know are a reality for people of color in the United States. And, you know, I've been lucky throughout my life to not really have to face threats, physical threats. And now, I mean, I have stories from friends all the time and sharing these anecdotes, but then also the research to back it up. And it's really a little bit frightening to just worry about my safety on a day-to-day basis.
Rosalind Chou, thanks so much for joining us.
Thank you for having me.
And that is it for this edition of The Heat. I'm Anand Naidu in Washington, D.C. Thanks for being with us.